arthroplasty beyond joint replacement, nutrition and mental health. The aim of my lecture would be to emphasize on the importance of nutrition and mental health in joint replacements. Prevalent nutritional deficiencies in India. Vitamin D deficiency is 61%. It's practically still ongoing pandemic. Vitamin C deficiency is 73%. Vitamin B12 53. Vitamin A 19. Protein deficiency, hypoalbuminemia, 91% of vegetarian and 85% of non-vegetarian population is in protein deficiency. Iron deficiency is 54 and folic acid deficiency is 37. Obese patients can be malnourished. 42% of malnourished patients were obese, whose BMI was more than 30 kg per meter square. Malnutrition in total joint arthroplasty. It is one of the most important preoperative modifiable risk factor to be addressed. It is usually under-recognized. There is no standardized approach to diagnose and treat malnutrition in total joint arthroplasties. Multiple surrogates for malnutrition exist, including serum markers, anthropometric measurements, and standardized scoring tools. The most important is albumin, then after total lymphocyte count and transferrin levels. Less commonly used are anthropometric measurements like calf and arm muscle measurements, triceps, skin fold. There is an article in Journal of Arthroplasty. Johnson reviewed 84,315 patients and found that malnutrition was the strongest risk factor for poor postoperative outcomes in joint arthroplasty. The conclusion of the paper is, despite knowledge that modifiable risk factors significantly influence postoperative outcomes, surgeons continue to operate on patients who are not optimized. Among the modifiable risk factors analyzed, hypoalbuminemia appears to be the strongest risk factor for all complications evaluated. Special attention should be paid to preoperative nutritional optimization. Scoring tools, Rennie McDonald Mini Nutritional Assessment and Squash Nutritional Index. However, serum markers and albumin in particular remain the most widely recognized and commonly used surrogates of malnutrition. Malnutrition can cause or aggravate every possible complications of joint arthroplasty. These are the commonest side effects which can be aggravated by malnutrition. Management includes, there is no standardized approach of treating malnutrition, probably due to the broad use of the definition. Perioperatively, adequate screening and diagnosis are needed. Multifactorial, multidisciplinary and holistic approach, team approach, including orthopedic surgeon, physician and nutritionist is needed. Better to diagnose preoperatively. Optimization with targeted diet and supplementation like tablets and whenever needed, injectable albumin also. These are the foods to eat before and after joint replacement surgery include high quality proteins, complex carbohydrates, calcium and vitamin D rich foods, vitamin C rich foods and anti-inflammatory fats. Vitamin D and sunlight exposure. Due to Tropic of Cancer, Indian population needs 8 to 10 minutes of daily sunlight exposure and that is between 11 am to 1 pm in afternoon. Take home message, malnutrition, an independent major risk factor for multiple postoperative complications. Multidisciplinary perioperative approach is needed to optimize. Obese patients can be malnourished. Preoperative correction causes a decrease in postoperative complications. Albumin, the most widely used serum markers for malnutrition. Repleting only albumin without addressing general nutritional deficiencies and concurrent comorbid conditions is unlikely to be effective. These are two very detailed articles which you should read on for nutrition in joint replacement. Now about mental health. Prevalence of psychiatric disorders in India, 14.3% of the total population, almost 19 crore people have psychiatric disorders in India and depression is most common among them. Prevalence of depression in India. National Mental Health Survey 2015-16 suggested 1 in every 20 Indians suffer from depression. World Health Organization 2017 report 4.5% of the world's total population has depression. Treatment gap. A 2016 study found that the treatment gap for common mental disorders was 80%. This is a new term, new onset depression. A 2012 study of 2 lakh patients found that 2.72% were diagnosed with new onset depression within a year of the surgery. Symptoms of new onset depression after total joint arthroplasty, an overall sense of hopelessness even when someone has a successful surgery and makes a full recovery. Decrease in threshold of pain, cognitive impairment, problem with difficult ability to think, remember judgment and make decisions, anxiety, changes in appetite and sleep pattern, difficulty concentrating on remembering, irritability, loss of interest in activities and sadness. Management of new onset depression includes medications, therapy, self-care, and sharing feelings. To prevent new onset depression after surgery, rely on friends, family, and neighbors. Do not get isolated. Get moving every day, participate in rehabilitation, follow a healthy diet, create a sleep schedule, get outside when you can, and be patient. Overall management of mental health, prevention and treatment. Mental health optimization. Surgeons should consider mental health optimization to be as important as other variables such as diabetes and anemia. Psychologist counseling before and after surgery. Setting realistic expectations, knowing what to expect before, during, and after the surgery. Vitamin C, and if needed, treatment of the underlying psychiatric condition. Mental health optimization, prehabilitation, a proactive approach that combines exercise, psychological support, and lifestyle changes to help patients build strength, endurance, and improve their resilience. Mental health assessment and intervention, and treatment expectations. These are some important articles from the Journal of Arthroplasty. Take home message, mental health issues are very common before and after surgery and can make your surgery unsuccessful. Mental health should be optimized before surgery with same importance as other comorbidities. Multidisciplinary perioperative approach is needed to optimize. Psychologist counseling before and after surgery plays a major role. New onset depression is a real thing and is increasing. Patient and relatives needs to be counseled properly for new onset depression and its treatment if its symptoms appear after surgery. I would like to say something about importance of doctor in normal population's life. There is a slok in Ved that calls Sarire Jarjari Bhute Vyati Grasse Kalevare Aushadam Janavitoyam Vaidyo Narayano Hari. It says when the body is suffering with the disease, medicines are like sacred waters of Ganga, and the doctor is none other than the supreme god Narayana himself. Thank you.